Hi everyone, it's Tiffany with Rock Bottom Wellness, and I'm here to recap something that is really frustrating to me, and it's something that I work with people on a regular basis, and it's also something I have personally struggled with and dealt with, and I just want to help break this down for you a little bit. There was a study, a survey done back in 2017, 2018. I think it was actually published in 2018, but it was a survey done of over 12,000 thyroid patients. So people who are treated for hypothyroidism. Now, this was like a survey that was sent out to people. And so some of the things you might say would not be a great way for this process to occur for people and to get the data from would be that probably if you're not satisfied with your thyroid treatment, you're going to be more than likely to probably want to answer a survey. So there's maybe some of that. Although the sample size was actually really good. So 12,000, a little bit over 12,000. And then at the end of the day, they took the data from 11,166 thyroid patients in order to accumulate this information and to come back with a takeaway of what is going on. So the bottom line is people feel underserved, undertreated, not listened to, frustrated with their current thyroid medications, the management, the treatment of it, and the satisfaction with their doctors that are providing this care is a failing grade, actually. And like I said, I talk about this with people all the time. I hear it all the time. And I kind of thought that my situation, I thought maybe it was sort of a fluke. It wasn't very common. And I'm seeing that that is not the case. So just to give you some information about what was looked at with this study, and I'm going to be shuffling through papers here. So you're going to hear that a little bit. But mostly it's women. So the responses, I should say, are 21-1. That was the ratio of women to men, female to male. And then they categorize them into different age groups. So it was under 40 all the way up to above 70. That was the categories. And then they looked at the etiology of the reason for thyroid treatment. Most of the respondents were being treated due to Hashimoto's or an autoimmune condition. Some were radioactive iodine, some were surgery, and some people, actually 34% of the respondents didn't really know why they were being treated for thyroid disease, which that to me seems, I don't understand that. And I can't find clarification on that in the study either. So what thyroid hormones are being treated with? Here are the three options that this survey looked at. Are you taking T4 only? So that's going to be something like a Synthroid or a levothyroxine, or I'm sorry, levothyroxine. Then there is the T4, T3 combination therapy. So that would be like a Synthroid and a Cytomel or the generic forms of those. Or there's a desiccated thyroid extract. So that's going to be like Armour Thyroid or Nature Thyroid, if you've heard of those. So those are the treatments that they were looking at specifically. And then it also looked at the length of time. So sadly, 41% of the respondents had been being treated for over 10 years and are very dissatisfied. And when I say dissatisfied on a scale of 1 to 10, they're rating it at a 5 out of 10. 5 out of 10 satisfaction with their providers and being listened to and getting and having options to work with to help deal with their levels. Some of the other maybe glitches you might say with the data that come out of this report would be things, do they have other conditions that are they a part of a thyroid condition or are they separate from the thyroid condition? So they try to parse that out as well. And also look at other comorbidities such as high blood pressure, heart disease, other cancers, thyroid cancers, depression, gut health, and all those kinds of things. So what I definitely see a pattern, and I know many other people do too, a pattern with people who have a thyroid condition also have a lot of these other things. It seems like there's a cluster of commonalities within the people that I work with. And like I said, I know a lot of people would say the same thing that some colleagues and that kind of thing, the people that they work with, they would say the same thing. I see clusters of depression, gut health, and, of course, the fatigue and lethargy, but depression and anxiety sort of on the continuum, going back and forth between symptoms depending on what's going on in their life. But it seems that if people are on an antidepressive medication, they're on a thyroid medication, they may also be on cholesterol medication or high blood pressure medication. There's lots of it to go around. And I don't know what came first, the whole chicken or the egg thing. But it seems like there is a very strong connection, a correlation between thyroid and a lot of these other things. And it doesn't really surprise me in that thyroid receptors are pretty much on every cell in your body. So I don't know how it couldn't affect some of these other things if your thyroid's not functioning that well. So some of the self-reported medical history, like I was talking about, would be current stress levels, other medical problems, how the stress and the medical problem connect, because we all know that if you are dealing with some kind of medical issue, it is stressful, even if it's considered sort of a mundane in and out kind of thing where you just need to get that colonoscopy and that's done. But that can just be creating a lot of anxiety, looking into it, waiting for results and that kind of thing. Also, if you have other things like heart disease, lung disease, diabetes, bone muscle issues, and then like I said, I mentioned the GI health, which is super, super common with thyroid conditions. That's something that I work with all the time. So they looked at the treatments, like I said, Synthroid only or T4 only, combination of T4 and T3, and then the natural version or the desiccated thyroid extract. And it seems like people who take the desiccated thyroid extract actually have a little bit better outcome. They have a little bit better outlook on how they feel their treatment has been. And I would say that I'm just looking at some of the data here. It's sort of across all ages, and male, female. It seems like the higher percentage or higher number of people, or I'm sorry, higher number of female are taking the desiccated thyroid extract versus male. But I don't know why that is. I know a lot of doctors are not super excited, it seems like, to try that kind of therapy if they have patients that are dissatisfied or not getting results with their T4 or their combination therapy. I know for me personally, I started out on T4 only, felt horrible, miserable. It was horrendous. It was the catalyst actually to do what I do now. So maybe it was a little bit of a blessing in disguise. But once I was put on the T4 T3 combo, my life absolutely changed. I had a different motivation level, I had better energy, I had better outlook. I was able to move forward. I honestly feel the way I was feeling on the T4 only was going nowhere but downhill, and it would have continued to go downhill with all the symptoms that I had, and including my outlook, depression, motivation, and everything that came with it. With the combination, for me, that made a huge difference. Although I've been in this stalemate mode, kind of like, I think it's working, I feel pretty good, I feel amazing, and then I have dips here and there, and I have just come to think of those as my normal, but I still feel that I could feel better, and I do all kinds of things to make me feel better, of course, based on what I'm explaining to you guys on a regular basis. And I have tried the Armour Thyroid, and it did not work for me, but I also don't know how it was dosed, or if it was dosed accurately, because it is very different than taking something that's measured in micrograms. It's the natural options are measured in grains typically, which are equal to the micrograms, but it's just a little trickier. And so if you have a provider that's not well versed in natural desiccated thyroid hormone because they maybe don't use it very often, that could signal some kind of issue, that could maybe be at the root of that. But personally, I have not really dared to go back to that because I slid backwards big time. But according to this study with those 11,166 people, their feeling overall is better satisfaction, not great satisfaction, but much better satisfaction compared to, say, T4 only. And that's considered the gold standard, by the way. That's considered the protocol, especially for some bigger hospitals in the area, bigger medical facilities in the area. T4 only therapy is considered the only way to do it. There have been several studies that have looked at combination therapy, the T4, T3 studies, and it's been sort of inconclusive. Nothing has been drastically, yes, this is the way to do it, or this helps so many people, or no, it didn't help at all, it actually made people worse. There's nothing really profound that has come from those studies. I know when I work with people, I know working with myself, that if I would not have had the option to have T3 added to my T4, that things would have gone really bad, and fast in a really bad way, in the wrong direction. T3, I definitely attribute to really turning the corner for myself. And I hear that with other people as well. I feel like it's getting to be a little bit more commonplace for people to be willing to prescribe it. I know my first doctor, no way, no how was he ever going to give me T3 along with the T4, because that's not how, quote unquote, they do it. So I knew that that wasn't going to be an option. I found another provider who was willing to do that on the first appointment that I saw him. And again, like I said before, it changed the trajectory of my health and my life. Here's kind of the saddest part about this. People are dissatisfied for a long time. There were 41% of people who have been treated for more than 10 years on T4 only that are dissatisfied. They give their treatment and their provider a 5 out of 10. 50%. They are totally dissatisfied. The provider, the system, whatever it is failing them at 50%. They're so unhappy with their treatment. 41% of people after 10 years, they're sticking around and waiting around. And I'm sure part of it might be that they feel like they don't know where else to go. They don't know who to see. It's exhausting. It is exhausting, because if you're feeling terrible on T4 only, you're exhausted, and you probably can't even put the thoughts together in order to figure out how to find someone that will actually help you. 44% after 10 years on combination therapy, not happy, not content with the treatment they've been getting. And then same, it's actually a little bit less with the desiccated thyroid extract, which at 39% of people were seeking treatment of that for over 10 years. And like I said, these people have reported very much dissatisfaction with their treatment. And so it's just really, really, and by the way, this information is all statistically significant. If you look at studies and want to look at this further, I will put the links to this in the comments so you can access it yourself. I'm just trying to pull things apart. I don't want to pull out all the details and all that kind of thing, because I don't want to get into the minutia of it. I'm giving you the highlights of what we're seeing and what you can do about it if you find yourself in this category. So, there's a lot of people who have tried alternative treatments, alternative types of physicians, changing physicians. I will tell you one thing, that's another thing that's kind of scary. So in my quest to find help and to get better, with the thyroid cancer piece of it, I had been hearing some things that just didn't make sense to me. Not that I didn't trust my doctor, but I just wanted that second opinion. So I was at one place for 3 years right after thyroid cancer and the treatment, the management of it. And I know I was not going to get anywhere when it came to actually helping me feel better. They were only focused on the cancer, which I know maybe sounds weird, that I didn't want to just focus on just the cancer. I wanted to actually function as well, but they were not going to help me or allow me other options to do that. So I fired them. I quit them. I found another doctor. In the meantime, I had already had that set up because I kind of knew where it was headed at my last appointment. Went to this new doctor. He's the one who gave me the T4, T3 combination the first time I met him, and I've been on it ever since. That was in 2010. And then with the cancer piece of things, there's lots of recurrence scares, and my numbers were not staying stable with regard to tumor markers. And so I sought out someone at a local area teaching university hospital facility who is a guru in thyroid cancer to have a second look. So she did her thing. I read my report, I get my report, and it basically said and ridiculed me for being a doctor hopper, and that I was just looking for something and just going to doctors for no reason, and totally discounted anything that I was trying to do to help support myself, and to figure myself out and feel better, and kind of made me feel ridiculous for getting what I guess I thought was a second opinion. But in her mind, I'd been to she was the third person I had sought out to look at the thyroid piece of it. I guess I thought it was second because I'd been with this other person for quite a while. The first one was more of the cancer management part of it and the initial parts of the cancer management. And so there you go. It made me not want to go seek out anybody else because I had these fluctuations, and every year or two or so, it was causing much strain, much stress, cost a lot of money, just affected my life greatly by the wait and watch method, and doing different kinds of treatments and therapies and PET scans, and the whole process is absolutely anxiety producing. So that is why I'm guessing a lot of people decide they don't want to branch out and ask, because they're ridiculed for asking other questions. I hope to God that if other people are doing that kind of thing, keep on and be stubborn and advocate for yourself, because that's just not a good place to be. And I didn't look in the conventional medical wisdom for help after that, aside from the doctor that I currently work with my thyroid management. I have sought other practitioners and have gotten much better response and much more help. So there are options, and that's what this is all about. If you are in this, if this sounds like you, if you could have been on the survey, maybe you answered the survey, who knows? If this could be you, and you are struggling after 10 or more years with chronic fatigue, with not understanding your brain fog or your lethargy or your joint pain or anxiety, depression, any of those types of things that you think are amped up during this time when you've been dealing with thyroid condition and you're not satisfied with your treatment, then you need to look elsewhere. You need to look at more of a functional physician. You need to look into functional nutrition. That also really helps. That's what I do, obviously. That helps to support that process and to work with other things that can help the thyroid function better. Or if you don't have a thyroid gland, it helps your medications just work a lot better. A lot of times when people deal with those underlying things nutritionally, thyroid medication doses can come down. If you don't have a thyroid gland or a non-functioning one, you're not going to ever not be on medication, from what I've ever seen or read. But there are other options that you have to seek out. Unfortunately, if you're used to paying people with insurance, if you really want the help to do other things or look elsewhere, at least see if they help you, you may not be able to use insurance. For some of those office visits, prescriptions and testing and stuff might be another story, but you need to look elsewhere if you want to be proactive and take charge of your health. I don't know, like I said, this study, it's 21 pages that I've been looking and reading through, but it's actually causes me a lot of stress and frustration when I'm reading this, because it kind of brings me back to where I have been in the past. It brings me right back into conversations I've had with the people that I've been working with and helping, and they're in the same boat. I'm sure if there was 20,000 people or 30,000 people that they surveyed, they probably have very, very similar results. It's just really, really sad to me. So Just kind of in summary with the type of treatment. So the T4 only combination, T4 and T3. And if you don't know what some of this is, please ask away in the comments. And then desiccated thyroid extract like Armor or Nature Thyroid. The people who felt the most satisfied with their treatment were the people taking the desiccated thyroid extract, which still wasn't that great, especially after the time frame. And 10 out of 10 or 9 out of 10 people talk about how negatively this hypothyroidism, in whatever way, shape, or form you have it, has affected their life. So that's pretty significant. And then how would you rate the need for new hypothyroid treatments? 10 out of 10 for across the board for either of the three or any of the three types of treatments currently being surveyed. It is really, really sad. And just the fact that people are afraid or don't know where to turn or who to ask, or if anybody will do anything different. The fact that people stay after 10 or more years and doing the same thing over and over again and feeling the same way over and over again that's probably the saddest part for me looking at that, because I know there's other things you can do. And the people I work with, I think that fatigue is probably number one. Weight management is up there. They probably tie for 1 and 2. But honestly, if people can deal with their fatigue and the weight, maybe it doesn't come off right away, but eventually starts coming off, that they don't care about the weight so much anymore. If they can just get over the hump and the hurdle of being debilitated by their fatigue, then their whole outlook on life opens up, and then things get better and weight starts to be a lot less of an issue. Mentally and also physically, it starts to be released because you're able to function normally and start being balanced. So I don't know. I just wanted to really help clarify some of this for people and to highlight that if you are feeling this way, it is not because this is your new normal, as they say, or because it's just the way it is and there's nothing you can do and this is the only option. There isn't. There's other things you can do, and there's other things that go into play. Yes, your thyroid affects pretty much every cell in your body, but when your thyroid isn't working, or if it's like just clogging away and it's just not really super efficient, then there are other things you need to look at, whether it be your hormones, your micronutrients, vitamins, minerals, antioxidants. All those things help to allow the thyroid to function a little bit better. There's so many avenues that you can look at. So don't give up. Don't take no for an answer if you're looking for some help. But then when you seek out that help, I encourage you to be open and listen and just realize that you've come this far, and you probably need to sit back and not be defensive. And I say that in the most loving way, because when you've gone through the gamut of trying every possible thing you think you could try to make yourself feel better, and then you listen to someone who has different information than you've ever heard, or maybe it's similar and you feel like you've done it all, just be open to really listen and just dig in and start it. Because when you get the right person who can help you navigate those issues and really see you for what you are and how you are feeling, and dig deep and look at the things you've done and the things that you are feeling currently, if they're really looking into that, you're going to be helped. I promise you. So if you have any questions, about some of the things in this study, you can reach out to me. If you need help looking at your numbers and just seeing where you should maybe be versus where you are compared to how you feel, and all the things, put all those pieces of the puzzle together, I can help with that. I invite you to get on a call. It's a thyroid breakthrough session. It is free. It helps me feel it out and see how I could help you, and it helps you decide if you would want to work with someone like me. So I have options. I get results. People start to feel better, and they get results because they're open to listen, and they're sick and tired of being sick and tired and fatigued and all those symptoms that if you have a thyroid condition, you know exactly what I'm talking about. So I guess bottom line, you're not alone, but there are options for you. So please don't give up. All right. Thanks for being here tonight. Take care. Talk to you soon. Bye.